Hi guys, my name is Zane Ferguson. My client's name is Kat Stevens. She's a 42-year-old female. In the differential diagnosis for her case, the first one is borderline personality disorder, and the second is histrionic disorder. She's got two primary diagnostic features. The first one is a lifelong pattern of excessive emotionality and attention-seeking behaviors, and the second primary diagnostic feature is at the core, these individuals experience extreme feelings of inadequacy, which is why they require constant external validation to reduce their feelings of anxiety that come with a sense of inadequacy. Now I'll go ahead and tell you guys a little bit about Kat Stevens. Like I said, she's a 42-year-old female. She works as a television reporter, and she's coming today seeking counseling after her most current boyfriend kind of walked out on her. Kat's a good-looking girl. She dresses usually kind of maybe young for her age, with her being 42, kind of low-cut tops, especially for being on TV, to kind of tight mini skirts, a lot of makeup, very kind of out there. Um, she goes through a lot of boyfriends or partners. Typically, she falls in love very fast, and then when they either fall in love back or they push away. If they fall in love back with her, she usually can find a few things wrong with him and she breaks it off herself. Um, she's just very in and out, hot or cold, really. She's been in a few serious relationships and marriage has been discussed, but the man's never really turned out to be, in her words, the right one. Um, she's also a very passionate person when it comes to wines. And oftentimes she can't find someone else who shares this passion. And while it may not be about them liking wines, it's more about Kat's kind of outbursts that happen when she does go tasting. She's very demanding when this happens. She draws a lot of unnecessary attention. She's very loud and outward. And oftentimes this is what drives people away, not their lack of, love for wine. Kat's a very, very smart woman. She's been in psychotherapy a few times in her life, and she can tell you kind of exactly what's wrong with her, and she can come up with very convincing explanations for why she is the way she is. She's not oblivious. She knows that, she has um, certain things that aren't quite right about her, and she can kind of explain these things and back up why they are and why she does the things that she does. Um, in her job as a news anchor, she's pretty successful, but not as successful as she could have been. Early on, she was praised, and everyone thought she was going to be on a major news network, but it hasn't really come. She's been a local market anchor for her whole career. Never really took the next step. Um, she kind of thinks that, or it's kind of thought that she is too picky with her work. Oftentimes, settling in somewhere and then finding too many things that are wrong with it. Um, she doesn't want to put in the time to step up to the next one. She constantly is changing, and um, her coworkers think that she's kind of more geared towards making sure people like her, and she gets along with the men and the males at the news station rather than kind of putting a good product out there, which definitely hurts her job prospects. She doesn't work well with other women. She doesn't really have any close female friends. She never has. A lot of male friends, um, but no close, good female friends, even in her family, which I'll talk about here. Kat is the youngest of three other sisters, and she's always kind of been the favorite of her parents. It started from a young age, and it's kind of pushed her sisters away. Um, Her parents are very invested in Kat's career. They kind of brag to their family and friends that, they're on TV and she's a reporter and whatnot. Even though her accomplishments really aren't that great for someone of her age in the industry. Um, Kat's pretty honest with herself, and she knows that she's not as happy as she could be. Even though her parents are really enthusiastic and have her back, she just knows that there's a lot of drama in her life, and she can lead a better life if she can kind of figure out exactly what's going on with her and figure out a way to help herself. Um, I'll go ahead and give you guys the multi-axial diagnosis next here. Um, the first axis is none. Axis 2 is histrionic disorder. Axis 3 is none. Axis 4 is none. And axis 5, the GAF, is 60. Got three theoretical perspectives today. First one is biological. I wrote, currently, little is known about histrionic disorder. as it is a lesser research disorder. From the studies we do have, they show that individuals with this disorder may have an excess of the neurotransmitter called norepinephrine. The neurotransmitter norepinephrine has been linked to those who are overly dramatic and emotional, which applies to Kat in this case. And there's no genetic link that we know of that can signal this disorder. Next up, we've got the behavioral perspective. The behaviors that our client exhibits may be from a faulty learning experience. And in this case, those learning experiences are operant conditioning and social learning. One idea is that those who have this condition may have lacked proper reinforcement as a child, leading them to seek it now and as an adult, outwardly seek it. They're not sure who they are or how they really feel, so they look to others to kind of guide them and to feel good about themselves. Also, a lack of ideal role models growing up can lead them to kind of a sense of lack of direction, or when they do pick up, role models, they're unrealistic and the expectations are too high. Um, Positive reinforcement also plays a role because they receive superficial praise that they kind of learn to crave and desire. And the last perspective is cognitive. And Kat has an irrational belief that she's inadequate, and this can lead to her acting out to get the praise, um, that what she's doing is right, and that she's kind of where she needs to be. She has to get it from an external view, not from herself. She's not very confident in herself. And that is all I've got on Kat Stevens today, guys. Thank you.